So there's a photo of me ziplining at the top of Europe. I had never ziplined before, so it was one of those bucket list items.
Having just returned from the trip of a lifetime with her daughter and husband, Abby Riveill is on cloud 9.
Every day we walked so many miles. At the end of our 16-day European vacation, we ended up walking 96 miles. We did go to the Paris catacombs.
It's an experience she once doubted would ever be possible.
About 200 stairs down and 200 stairs back up.
Abby's medical journey actually began 12 years ago at the age of 29 when she was having lunch with some coworkers.
We were at a restaurant downtown and I fainted at lunch.
Her general practitioner referred her to a cardiologist for some testing.
And during that, I had an 8-second asystole pause.
What's that?
Where my heart flatlined.
She was diagnosed with something called neurocardiogenic syncope, meaning her body's nervous system was malfunctioning, causing sudden drops in blood pressure and bouts of slower heart rates, causing her to pass out. She was referred to the University of Kansas Health System electrophysiologist Rhea Pimentel for a pacemaker.
Dr. Pimentel really made me feel comfortable, and it was nice that she was young and she obviously knew what she was talking about, and she's very talented and she came highly recommended from everybody.
For the next decade, Abby's life went back to normal until 2023. That's when her OBGYN recommended genetic testing because of a family history of breast and ovarian cancers. The test revealed that Abby carried the BRCA gene, and she knew she had some very big choices to make.
This is telling me I have an 87% chance of getting hereditary breast cancer or ovarian cancer. So if I have an 87% chance that a plane is going to crash, if I stepped onto it, would I get on the plane?
4 months later, Abby had a hysterectomy. Next, she scheduled a double mastectomy and reconstructive surgeries. But those surgeries on her breasts would be complicated by the pacemaker already implanted in Abby's chest.
One of the big concerns with the placement of the pacemaker is you cannot get clean margins when you're doing the mastectomy.
Her oncology, cardiology, and surgical teams all met together to come up with a treatment plan. First, they'd remove the pacemaker. Next, they'd perform the mastectomy and reconstructive surgeries, and then replace the old pacemaker with this, the tiniest pacemaker in existence. It's about the size of a pinky fingertip. It's also leadless, meaning there are no wires, which doctors say makes this kind of pacemaker a great option post-mastectomy. Even better, it was installed through Abby's femoral vein. No more cutting and no residual lumps or bumps in the chest. And once Abby was on the other side of the most grueling year she's ever endured,
I felt the huge sense of relief. After the surgery, you think that you will never be the same. It feels so cumbersome, but a year later and I was back to normal, and that was, a miracle in itself.